Welcome back. We do apologize for those technical difficulties a little bit earlier as we continue our conversation concerning suicides in prisons. Now, Deputy Commissioner, you were indicating that you try and handle issues of suicide with regards to offenders in a sensitive manner?
Yes, so I was just giving the pronunciation of the organization currently. We are handling the suicide that occurred on Friday as we would any other death of an inmate that would occur in a correctional facility. So namely, we've opened an inquest document with the Namibian police force, and we're still awaiting investigations to reveal, of course, the circumstances and the cause of death of the inmate.
So there hasn't been any further findings since the suicide was committed?
No, currently not. The investigations are still ongoing. However, it is worthwhile to reveal that one would say that up to this point, nothing really appears untoward about the circumstances of the inmates passing away.
Okay. Now, talk to us about some of the mental and psychiatric related services that are offered at the Namibian Correctional Services.
We've got several mental health interventions that do occur. Maybe I can start with upon admission, actually. Upon admission, all of the inmates are screened. They undergo a medical and health screening, which is conducted within the first 48 hours of their admission, right? So this admission is then done in order to assess the immediate health needs and the immediate risks that these inmates may pose. Part of this assessment, of course, there is a mental health component, which is particularly designed to identify any symptoms of mental health problems, such as specifically suicide risk or risks for suicide or for self-harm tendencies. So once these inmates might have been identified to be displaying these symptoms, which can be quite problematic, then they are referred to the relevant officers within the correctional facility who have the necessary qualifications to be able to offer these interventions. However, you do find, of course, that we're not always able to treat everything that does occur to us. So sometimes there might be a need for us to refer these inmates to external stakeholders, such as the Ministry of Health and Social Services. I would also say that upon admission as well, there is also a big emphasis on inmates undergoing the orientation program. This orientation program is particularly designed to help inmates familiarize themselves with the correctional environment, because it's a new environment. They might not have knowledge of what is expected of them, but also most importantly, the orientation program exposes them to the services that are available, because especially upon admission, inmates have a better understanding of themselves. They might know the problems that they might have suffered with in community prior to incarceration, and especially if these are mental health problems, it's essential when they get into the correctional facility that they know where they can access these services should the need arise. In addition, to supplement the orientation program, we do also have an offender empowerment program, which inmates are able to partake in once they've been assigned to a living unit. And the point of the offender empowerment program is to help inmates with their adjustment. As I had mentioned earlier on, this is a new environment and they don't always know what to expect. So this offender empowerment program has a strong emphasis on adjustment, and it's just generally there to enhance the overall mental well-being of inmates and to reduce psychological distress insofar as is possible. Throughout their incarceration, we do have case management officers as well. So all inmates have access to a case management officer who has a background in human sciences. But because these are not specialist mental health providers, there might be events where they might need to refer these inmates to other officers, which in our case would be program officers. In the event, of course, that they need specialist care, say, for example, they are presenting with symptoms of post-traumatic stress disorder or symptoms of schizophrenia, things that might require specialist intervention, we do refer them to the Ministry of Health and Social Services for them to be attended to by psychiatrists as need may be. Okay. Maybe just in conclusion, we do also have religious care and chaplaincy officers who are there to offer spiritual guidance to inmates who might want to take that route as opposed to the traditional psychological route as well in terms of addressing their mental health problems.
Quite a comprehensive overview. Now, the issue of that you also mentioned in your text when you're speaking now, it concerns the issue of lack of adequate mental health services providers, and specifically Namibians suffer from such a case. What is the current specials, what do you call them? We're talking about the the ratio of the people that are offering the service that you're just referring to when it comes to the inmate? What is that current ratio in terms of specialists that are available to provide probably even services such as related to mental health when it comes to inmates?
Maybe before I get to the ratio, I would just like to point out that with the implementation of the offender risk management correctional strategy of the correctional service, it has seen the service expand its workforce and diversify its workforce to include more professionals with psychology and social work degrees. So in terms of the ratio, I would say we've got approximately 156 of these professionals with this background who comprise the workforce of the Namibian Correctional Service, and they are shared across the 14 correctional facilities of the service. However, of course, I think you do mention an important point when you speak about just the shortage of specialists in the country. And I think as an organization, we can concede that we experience that lack as well. However, it is our vision in the future to diversify our workforce to include more specialists, such as clinical psychologists specifically, who are more advanced in dealing with mental health problems.
Okay. Now, knowing that you have this shortage in terms of the skills that you require, are there specific interventions that the National Correctional Services is doing to ensure that you fill this skills gap?
Yeah, perhaps to borrow from myself, as what I had said earlier on, maybe what we do, first and foremost, I would like to highlight the cordial working relationship that we do have with the Ministry of Health and Social Services. So primarily they are a big aid in filling this gap for us in the event that there is a need or that there are circumstances that we are not able to address within the correctional facility. We are able to refer to the Ministry of Health for further intervention. But also maybe just to illustrate this relationship, we also do have psychiatrists from the Ministry of Health and Social Services that visit selected correctional facilities in order to assess the continuous mental health needs of our inmates, as well as to assess how those who are already initiated on treatment are responding to their treatment. I would also like to add that in the event that inmates prefer to access private mental health service providers, they are not restricted from doing so. However, this is done at their own cost as an organization. We're just not able to accommodate that, unfortunately.
Okay. Now, for the interest of our viewers, talk to us about the frequency of suicides rate within the Namibian Correctional Services.
The frequency, all right. Perhaps I can just look at a specific time period. I would like to perhaps highlight the time period of January 2022 to date, which is August the 9th, I think, if I'm correct. The Namibian Correctional Service has seen 5 suicides, which were all committed by male inmates. In terms of just a brief analysis, perhaps we can say that the average age of these inmates was 35 years old, and 2 of the 5 inmates were foreigners. Unfortunately, however, we're not necessarily able to speak on the contributing factors that might have led to these suicides, as none of these inmates had left suicide notes, and none of them had really shown or displayed or were observed to have displayed any signs or any warning signs which are associated with suicide risk. So there was nothing alarming or untoward about their behavior before the committal of the acts. Hence, the causes are currently unknown to us.
Okay. Is there anything that you might have left out this morning in our discussion that you might want to share now?
In our discussion, perhaps I think I just wanted to go back to the earlier question, actually, where we spoke a bit about how we also compensate for the gap that we have in service provision. I think it's also important to note that we do try our best to partner with external service providers, such as the Office of the First Lady and other faith-based organizations, which are able to give services in the event that we're not able to, which does narrow the gap in service provision to our inmate population. Yes.
Okay. Well, Deputy Commissioner, thank you very much for making time to speak to us this morning.
Thank you.
Okay.